Happy Wednesday. Happy Wednesday, everyone. If you have had a long day and you were just pushing through it, but then you said, you know what? I'm trying to pass NCLEX. I need to show up for class. I want to congratulate you for being about your business, because tonight we are talking about a very important topic. We have here, hi everyone, we have here chronic lymphocytic leukemia. Yes, this is the topic for this evening. So I wanted to make sure that we are addressing those subjects that are going to make you, number one, a better nurse, but also make you be able to pass your NCLEX. So let me know where everybody is from. I love to see it. I have Missouri in the house. I have South Africa. Come on in. We are just starting class. And before we get into our topic for tonight, I want to go over some of the things that we have coming up in our community events. We know that the app for your curriculum is now available. So whether you have iOS or if you have Android, you can go ahead and search ReMar V2 and download the app for free. Isn't that exciting to be able to have the curriculum that you are studying on your phone? It's so easy. Go download it. Also, Black Friday is coming, and that means we have so many events just surrounding our big NCLEX review, our 4-hour NCLEX review the day after Thanksgiving. So if you have not signed up for the Black Friday events, promotions, new products, giveaways, we're doing some cash giveaways. This is going to be very big. We have some game nights coming up. Please go to remarnurse.com/Black Friday. And this is, again, another opportunity to keep you engaged in your nursing curriculum, to keep you excited about studying, and also a good progress marker. Are you tapped in to what your peers are doing? Because we're all trying to pass this NCLEX, do better in our nursing knowledge. So Black Friday is an opportunity for you to do that. And it doesn't matter where you are in the planet. Okay, I like that. I will pass my NCLEX. That is right. So yeah, it doesn't matter where you are. North America, South America, Central America, Europe, Australia, you can participate in our NCLEX review in our game nights that we have coming up. So please go to remarnurse.com/Black Friday. Hi there, Indianapolis in the house. Love to see my neighbor here. Oh, and Doha. Okay. One other important announcement that I have, you guys know this is my year for amazing partnerships, and we are much more than an NCLEX prep company. We are a nursing education, career journey, magnificent, wonderful, everything you need it to be. We are everything you need to be nursing company. So we now have a partnership with Jobs. Yes. Our Safe Nurse Now partner is going to be able to provide you the very best jobs that you can obtain as a nurse, as a licensed practical nurse, a vocational nurse. We have it all with Safe Nurse Now. So I'm going to talk a little bit more about how you can learn more about getting jobs now with ReMar. We got ReMar Nurse jobs with Safe Nurse Now. Remember, I always ask you, are you a safe nurse? There's a reason why I've been asking you that, because that's going to be very important on your career path. Hi, I passed last month from your V2. Why, thank you for letting us know your very good news. I love when nurses pass. I love when nurses are real life testimonials that I can, I will, I must. People who are not giving up, even though the journey is hard and it's long. To have someone come on and say, I did it, and so can you, is so important. So it seems like I actually have a real ReMar nurse here for you guys, and I'm not going to even wait any longer. I'm just going to bring her on so she can say hi to everyone. Hello. How are you? Oh, we can't. We're having trouble hearing you. I like the ReMar shirt, though. No, we can't. Can you guys hear her, or is it just me? You got to say something. Say something that maybe we could try. But this nurse obviously passed because she's wearing our clothing. When you pass the NCLEX with ReMar, you're going to get the ReMar nurse shirt. It's so beautiful. You get to rep it, ReMar nurse. And that's how we know who you are. Okay, so maybe she'll come back on. We'll get the audio straightened out. Let's get into our subject tonight, shall we? All right, so here we go. Oh, and let me just preface this by saying, remember, we're moving from a place where we're just trying to memorize stuff to a place that we can actually apply our knowledge in a real life scenario. So this is what we've been doing for our studying. A 65-year-old man comes in with fatigue, swollen lymph nodes, and frequent infections. Blood tests show high white blood cell counts and more lymphocytes with smudge cells seen under the microscope. Flow cytometry confirms abnormal B cells. Okay, so you have a client presentation here. Do you remember what we're talking about today? Do you remember what our subject is? Our subject is CLL. That might be documented in the chart, okay? CLL, chronic lymphocytic leukemia, all right? And so now you have a patient that shows up with fatigue, swollen lymph nodes, and frequent infections. Can you make that leap to why this is happening based on just the diagnosis? All right. So we're gonna be able to make sure that you can do that by the end of this broadcast. Hi, everybody. Come on in. All right. So here are my first questions. When we talk about chronic lymphocytic leukemia, somebody is like, I can do it. You can do it. We're talking about B lymphocytes. So in the comments, I want you to put this because I want to see it. What are B lymphocytes? Why does it matter that the diagnostic test tells us that the B lymphocytes are abnormal? So I'm asking you, what are B lymphocytes and what role do they play in the body? If you could just think of one of the answers, right? Because when you know content, when you know the information, it comes to you just like that. Oh, I know B lymphocytes. I know what they are. And more importantly, I know where they are, because you want to know where this is all taking place, because this is a leukemia. Okay, so let me answer it. So where are B lymphocytes? B lymphocytes are in the bone marrow. Okay, so we know that they are a part of our immune system. B lymphocytes are right, exactly. They are used to fight infection, white blood cell. These are great comments. Excellent. So we know now what is being affected. So when we talk about having a cancer of B lymphocytes, when we talk about having a cancer of this location, it's going to affect a lot of other parts of the body. When you have a cancer in the bone marrow, how many other parts, how many other aspects of pathophysiology are going to be affected? So many. So hopefully we will begin to digest what those parts are and why they are happening. Because our patient came in with fatigue, right? He came in with a lot of different symptoms. Let me ask you this question. Because we have a cancer, because we have a leukemia, there is a rapid proliferation or a rapid growth, okay, of the B lymphocytes. So I asked the question here, how does the accumulation of dysfunctional lymphocytes in the blood and the lymphatic system affect the body's ability to fight infections? Yeah, it's going to affect the body. It's going to affect the entire body because, you have lymph nodes all over. But also, why is it going to affect the entire body? Because we're dealing with the blood here. And so when we have those dysfunctional lymphocytes, what is the problem with the dysfunctional lymphocytes? Well, when it's a cancer, even though the cells are replicating, Are they replicating to be healthy functional cells? Are they replicating to be cells that are stronger every time they replicate? What do you guys say? No, actually, when you have a cancer cell, not only is it replicating quickly, but it's also not replicating as its best self. So it's mutated when it replicates. So these B lymphocytes, the reason why they're dysfunctional is because they don't actually help with the immune system when they become cancerous. They don't. They're not healthy types of white blood cells. Yes. So this is the problem with these B lymphocytes. They're proliferating, and yes, they're working against the immune system in so many ways. So think about that when we think about cancer. All those cells that are replicating, they're mutated. So if you have a red blood cell that becomes cancerous, when it replicates, it's not going to be able to carry oxygen like a healthy cell would. Okay. All right. So let's let me just read what I have here for my notes. Yeah. These abnormal lymphocytes don't work properly, so they can't make enough antibodies to fight infections. Another issue with this type of leukemia is it takes up space in the bone marrow. So it's taking up more room than it's supposed to, which prevents the healthy production of cells. And so this can also lead to the other parts of the blood being low red blood cells, low platelets. So this puts our patient at risk for, if we have low red blood cells, what does it put our patient at risk for? Leukemia puts our patient at risk for anemia. Okay. Also at risk for bleeding. Yes, we're going to have so many issues. We're going to have so many issues here. So this is why this is a very important topic to indeed understand, All right. So our clinical manifestations, we are going to have the B symptoms, okay? Or when you have irregular or dysfunctional B lymphocyte symptoms, you're going to present like our patient presented. So drenching night sweats. Yes. Okay. Reoccurrent infections. And so we're understanding why. This is the whole reason why I want you to show up for class, because you're going to have a patient that you need to be able to understand and explain what's going on. Okay. Unintentional weight loss and fatigue. Now with next gen NCLEX, we have to be very careful because they will give you differential diagnoses. So that means, yes, this patient has chronic lymphocytic leukemia. However, yes, I like that, Lourdes. And Lourdes is a regular that comes here. These symptoms also present like HIV. What else? There's one more thing, okay? There's one more thing that these symptoms are presenting like to me. You guys can probably think of more than one, but there's one more thing that I'm thinking of. This could be HIV. This could be this leukemia. Because you saw the night sweats, you should be thinking, TB. Somebody said, oh, this sounds like COVID to me too. Okay. Yeah. So this is an important point when we talk about next gen NCLEX, because you're going to have to be able to know the information so well that you can do a differential diagnosis. Yeah. Other clinical manifestations this patient may have. And again, you should be familiar with these terms and what these manifestations are. So enlarged lymph nodes. Why is that happening? Splenomegaly. What does that mean? Why is it happening here? Hepatomegaly. You're also going to see an enlargement of the what organ? The liver. Okay. Why is it happening? Why are these organs getting enlarged? Skin lesions. Is it because those B lymphocytes there's so many that they're coming out through the skin? It can happen. And of course, on our laboratory value, we have elevated lymphocytes. So essentially, because these B lymphocytes are becoming so numerous. They're starting to clog up the organs that are responsible for filtering the blood. So you know the spleen does that. And so they get backed up in the organs. Yes. And this is what I love. Our comments are so good tonight. They are building up in the organs. They're building up in the lymph nodes. And so the lymph nodes begin to swell. The spleen is saying, hey, I'm not supposed to be filtering all these B lymphocytes. I'm getting backed up. The liver, the same thing. Okay. And so understanding why these things are happening, that's our goal. That's our goal. How is it diagnosed? Well, we need to look at the blood. So a peripheral smear can be done, immunophenotypic analysis of circulating lymphocytes. What do they look like? Are they normal? Are they abnormal? A bone marrow aspirate, very painful, and a biopsy can be done, or a pathologic evaluation of lymph nodes and spleen. So you are understanding now, okay? You're understanding now as we talk through it. And I see a comment from Marcia that says, I feel like I don't know this stuff. You know what? I'm glad, number one, that you're able to admit that, because instead of pretending like you do, you are saying, okay, I need to increase my knowledge in this area. Because Marcia, I bet you that you do have a strong point in nursing. I bet that it might be, maybe it's pediatrics or maternity where you're very strong, but maybe oncology and cancer is a tough subject for you. Okay. That's normal. That's normal. How many other people struggle with some subjects in nursing? Yeah, you struggle with some. So all you're realizing right now is I need to put a little bit more effort into this one area for tonight. And that's another reason why we come and we discuss case studies to see what are our weak areas. All right, I think I might have the ReMar nurse back. Hello. Oh no, I still can't hear you. We can't hear you. Try. No. Oh, we can't hear you. I don't know what to do. Is it just me? I can't hear. Maybe it's that. Maybe it's the phone. Maybe it's the earbuds. She said, I'm taking the earbuds out. We want to hear the testimonial. No, it's true. When I was talking about the weak areas. No, still nothing. Okay, I know you've been working on it. Okay, so I think some.
Hi, my name is Tequila Hartzog, and I'm here to share my story. 7 times, yes, it took me 7 times to pass NCLEX, but you know what? I didn't give up. I told myself I can, and I will, and I have passed NCLEX. This is my motivational wall. You have to motivate yourself, and I did. This, when she say do the quick facts and the V2, you got to do it. Okay, you can't half it. You have to do exactly how Regina says it. And I even attended Mondays and Wednesdays and took notes. And this is my quick facts book. As you can see, I've completely made it through the whole quick facts. Not only that, this is the V2 program that I have went through multiple times, word for word. All I can say is listen to Regina and Mark. And what they say, with God, all is possible. And I couldn't have done it without the Heavenly Father. And thank you, Regina and Mark.
I love it. We got a chance to hear your wonderful testimonial. She says, I may not know all his plans, but I know I'm in his hands. Look at that, y'all. That is so good. We are congratulating you. And we just thank you so much for that beautiful video, because we could tell the joy and we could tell, you're a real person and it wasn't easy. And obviously you put in the work to make it possible for yourself. So that just lets me know, number one, you're a safe nurse. You're going to be a safe nurse. And then number 2, that you are not your ReMar nurse. Yes, with God, it's possible. Listen, we let nothing stop us around here. Language barriers, technical issues. We are going to communicate by God's grace. We're going to communicate. So thank you so much. And maybe we'll be able to hear you, because we still can't, but maybe we'll have to bring you back on or figure it out, okay? Because I really want to hear your words, and I really want to be able to just communicate with you. Okay. All right, guys. So yes, she said, even though I might not know his plans, I know that I'm in his hands. That's my testimony too. That's my testimonial. It's like, I don't know what's going on, but Lord, I trust you. So we're talking about how chronic lymphocytic leukemia can be diagnosed. Okay. And the management is very interesting because there are some forms of cancer that doctors monitor. Okay. There are some forms of cancer where doctors just have to monitor it because the patient is not symptomatic. And so there is nothing that can be done or is to be done. Clients who remain asymptomatic, clients who remain asymptomatic does not require treatment. However, the client is closely monitored through blood counts and imaging studies. So this was a condition actually my great grandmother had. And when she got it, she was in her 80s. And so the doctor had the option, do you want to do aggressive treatment or do you want to let this natural process take its course? And so I can actually report that my grandmother lived quite some time with this form of cancer. So as with all cancers, they have different stages. They present either very aggressive, sometimes very slow moving. So the management of this particular cancer will depend on the patient and the doctor. Okay, patient and the doctor. But if you do want to intervene with this cancer, there's going to be two primary ways of managing it. And we need to be able to understand how those ways affect this particular cancer. Number one, chemotherapy. Do you understand how chemotherapy affects cancer? I feel like most of us do, right? I feel like we know chemotherapy is going to completely wipe out the cells. Okay, good or bad? Chemotherapy will get rid of them all. Is that a principle we can all understand and agree? But this other one here, okay, this other one here, transplantation, I want to spend not a lot of time with. I want to spend some time with, because you may hear in the media stem cell transplants, or you may read in your med-surg book, the patient is going to require a stem cell transplant. How does that help? What even is that? Who can put in the comments, what is a stem cell transplant? Like, who knows what it is just simply? Like, if somebody asked you, the doctor wants me to get a stem cell transplant, what is that? What would you say? I love the testimonials. I passed my NCLEX in August. Okay, thank you. I'm a ReMar nurse. Glory, hallelujah. I pray for everyone on here. You will come back with testimonials soon. Thank you so much, Emmanuel. Thank you so much for that testimonial and praying for us who are here. Hello, Professor Regina. God did it for me. Lourdes, let's do it together. Okay, we're doing a community. I did my NCLEX exam on the 8th of November, and I passed with 90 questions. Oh, that's so good. My God really moves. Thank you, Professor. Okay, I hope this is motivating you guys. This is Winning Wednesday, and we got some winning going on. So I asked, what was stem cell transplantation? And I'm seeing here removal of old cells with new cells. I like that. Transplanting good cells in the bone to regenerate cells. Stem cell transplantation. Replacement of damaged cells. To treat blood disorders or unhealthy cells. Okay, are you guys understanding from these great comments that are popping in? Now, it's true. When we talk about stem cell transplant, the one thing about stem cells that make them so cool is that when you do a stem cell transplant, these specialized cells can turn into healthy ones, right? They can replace the healthy cells that are that have been damaged in the patient. So if you need B lymphocytes, you can do a stem cell transplant of those. Like, so stem cell transplant it's a replacement. It's a replacement therapy. And it is very, very helpful where maybe chemotherapy has not worked for the patient. Okay. But I do want it to go over this medical emergency. You want to be mindful of it is tumor lysis syndrome. Tumor lysis syndrome, because this can happen when we are treating patients with cancer. And initially, it happens when a tumor is broken down, when a lysis takes place. That tumor contains things, right? A tumor is a group of cells. So cells contain what? Electrolytes, proteins, things like that. So when they're broken down quickly, that gets released into the bloodstream. And when something is released into the bloodstream, whose job is it to clean it up? It's the kidney's job. So you have this release from the tumor being broken down of, what do I have here? Potassium, phosphate, and nucleic acid. So much of it that it begins to damage the kidneys when the kidneys are trying to just filter. All right. And so now the patient ends up having acute kidney injury. There you go. You took the words right out of my mouth. So the patient ends up having kidney failure. They end up becoming toxic. And what did we learn about congestive heart failure? The kidneys and the heart go together. So when you have kidney issues, that is going to affect your heart. Okay. Tumor lysis syndrome. If you didn't understand it, now you know. Okay. Now you know. All right. So again, our nursing considerations, we have to be able to look at this patient from the time that they're admitted and know exactly what their issue is, how we're going to expect them to present, how we are going to investigate if it's one thing or another, and then how we're going to treat it. Okay. So we know that clients with this form of cancer, this form of leukemia, they need to be referred to a specialist that's going to look at the blood. We also need to be monitoring for the development of the B symptoms, which we listed previously. And we need to do blood monitoring. Number 3, hematologic monitoring. We got absolute lymphocyte counts. We need to know anemia, thrombocytopenia. Imaging studies will show us the patient having enlarged organs, the spleen and the liver. We now know why that's happening. Those B lymphocytes are getting blocked in those organs. This patient is prone to opportunistic infections. Why? We answered that. We answered that in class today. And then, of course, the big thing, monitoring for tumor lysis syndrome. And this is why we study content first before we start doing these practice questions that are coming up. That is my secret to being successful on NCLEX, doing the content, actually studying for understanding, not just memorizing facts, studying for understanding. Yeah, fluid overload too. That's good. Okay, it's time for the NCLEX questions. Lista? Yeah. All right, number 1 is this. In understanding immune effectors, the nurse must know that B cells are produced in the blank and matures in the blank. Number 1, is it produced in the kidneys, matures in the liver? 2, produced in the bone marrow, matured in the spleen? 3, produced in the pancreas, matures in the spleen? Or 4, produced in the bone marrow, matures in the liver? We are talking about B lymphocytes. And what I'm doing is just testing, just testing how much you know. Okay. I see some 2s, but I also see some 4s. So which one is it? Is it 2 or is it 4? Okay. All right. So here is the answer. Somebody put it's 2 and it's 4. No. That's not how it works. Correct answer is 2. You got it right. If you put that those B lymphocytes are produced in the bone marrow, matures in the spleen. I'm moving on. Here we go. This is definitely question number 2. A client with chronic lymphocytic leukemia should be monitored for the development of B symptoms, which include number 1, headache and double vision. 2, recurrent infections and drenching night sweats. 3, drenching night sweats and mood swings. Or 4, unintentional weight loss and bowel movement changes. What are we gonna say? What are we gonna say here? 1, 2, 3, or 4. And listen, if you are enjoying this Winning Wednesday, guess what? We're coming back again on Monday and Wednesday. Wednesday, we have a game night next week. We have the Black Friday NCLEX review coming up. We're having game nights on the week of Thanksgiving. We're having game nights like every day that week, every day for the holiday. So sign up if you have not, remarnurse.com/Black Friday, because we are going to have a good time this month. It is as well number 2, if you got it, recurrent infections and drenching night sweats. That was the right answer. Okay, next question is this. This is the tough one. A 70-year-old patient with chronic lymphocytic leukemia is admitted to the hospital after experiencing a rapid onset of weakness, confusion, and irregular heart rhythms. Laboratory results show elevated potassium and phosphate levels, along with a decreased urine output. What is the priority nursing intervention? Is it number 1, administer a potassium binder as ordered? 2, initiate an IV infusion of normal saline? 3, prepare the patient for chemotherapy immediately? 4, administer an antihypertensive medication as ordered? I cannot believe there's over 700 people right now in the room. Over 700 of you all. I don't even know where everybody is from, but every household here represented. May God bless you abundantly as you are on your journey, and may you be so grateful for the opportunity. Okay. Well, it looks like tonight we have done it again. We have managed Chicago. I see you. UK. I'm coming for you, UK. We've managed to make all the answers 2. How did we do that again? That was what we did last week. All right. So number 2, initiate an IV infusion of normal saline, because what's happening here, remember we talked about tumor lysis syndrome? That's what's happening right here. And we need to be able to help that patient's kidneys and heart. We need to be able to give that patient IV fluid to help hydrate, to help the kidneys flush that potassium excess. All right, that potassium excess out. All right, great job, everyone. I am now confident that if you get any NCLEX question with abnormal B lymphocytes, the B lymphocytes, stem cell transplantation, bone marrow suppression, you guys will know it. You guys will know it like the back of your hand. I want to go back to the beginning of the broadcast, okay? I like this, Lourdes. Because Lourdes, I see every time you show up, and I know you have the V2. I see every time you show up and you participate in class, you get better and better. You're providing answers so quickly. I get used to seeing certain names on these broadcasts coming to class. So it's always a pleasure when I see you. There's a couple of people that I just know. I know by the name. So I do want to talk about Safe Nurse Now. That is our partnership that has ReMar jobs where nurses can work. And we literally have jobs all over the country. We actually just placed an LPN in Texas, and I'm really happy. I can't wait for her to start working. So I wanted to talk more about how you, ReMar nurses, can sign up for Safe Nurse Now. And also somebody said, look, I like this. I am 3 out of 3. I'm a safe nurse tonight. That is what I'm looking for. I'm looking for nurses who are safe, who will be able to also have amazing jobs and career. So if we have the video, play that beautiful video about Safe Nurse Now. AG Hetty says, I'm trusting the process with ReMar. I like it. I'm understanding prioritization better. So this lets me know the things that I need to bring for Black Friday. As we get the video ready, you guys know for Black Friday in about 10 days, we will be releasing our new nursing course, which I'm really excited for those in nursing school who need help with fundamentals, with some pharmacology, with some A&P. We're going to have a new course for you to enjoy. We'll also have our TEAS course. Whew, the TEAS course has been coming for such a long time. So we will be having the TEAS videos, math and science and reading, all those things, okay? All those things. And it's just going to be an amazing opportunity for us to study together, plus the game night. So we're going to, maybe, am I supposed to play? I'm supposed to play Safe Nurse Now? Okay, here is Safe Nurse Now. Again, this is... When you become a nurse, you realize that our schedules, the shifts, and just the stress of the entire job takes over. And although many of you may know that I'm a nurse, what you don't know probably is that the majority of my career I spent as a travel nurse. And let me tell you why. I learned so much by being able to visit different facilities and learn their charting system or learn their processes for certain procedures. I mean, it just opens up your world when you dive into traveling. It's Professor Regina here, and I'm so excited to tell you about our new partnership with Safe Nurse Now. And so this gives you more control over your nursing career, but also over your time. That's why it was so special for me to join hands with Safe Nurse Now and let you know about it. Because with Safe Nurse Now, you get to take back that freedom. You get to decide when you work and where you work. If you're like me, you probably got into nursing for 2 reasons. 1, to help people. 2, to have more freedom in your life. I'm choosing to work this shift because it works for my family this week. Or I'm picking up this shift in this location because it's where I feel the most energized. It's where I want to travel. It's where I want to visit. And so Safe Nurse Now is more than just a staffing company. It's really a chance to design your career and design one that works for you. So whether you want to take on more hours, spend more time at home, or just build in the ability to have travel and adventure in your life, this is your chance. It's a chance to design a career that works for you. Like, I was able to start ReMar Review because I worked when I wanted to and how often I wanted to. And so my partnership with Safe Nurse Now is so special because I get to give other nurses the opportunity to create the lifestyle that they really want to have. And in nursing, you have to take control of your nursing career if you want it to serve you in certain areas. So if you are looking to spend more time with your family, if you are looking to be able to travel, if you are looking to be able to work when you want to and not when you don't want to, then this is a perfect opportunity. And I am so excited for the nurses who will see the opportunity that it is and take advantage of it, because there is nothing more rewarding to have a career that you're actually proud of and one that you are directing and steering. I know that you're out there and you're looking to go back to school, you're looking to work certain holidays and be off other holidays. With Safe Nurse Now, we are committed to supporting you at every step of the way. So if that's signing you up for the job, you learning more about the job, we are going to be here to make sure that you find the position that highlights your strengths. And so take the challenge, click the link and sign up to learn more about the positions that we have to offer you and how you can take your travel nursing career to the next level. Check out Safe Nurse Now. This is the time where you get to build the life that you want. And of course, we're here to support you every step of the way. So click the link and let's get started. A lot of people wonder how I'm able to do what I do, how I was able to do ReMar, do nursing for so long. And the way I did it was because I was a travel nurse. I literally was a travel nurse, and that gave me, and what I'm trying to give you all is the understanding that there are some things that are more important than money. And for me, it is control of my time, freedom, flexibility. That's how I was able to do it. Travel nursing opened up so many doors and opportunities for me to be able to actually do something that I loved. So I would take a travel assignment. I would literally work for 2 months or 3 months, and then I wouldn't work again for 6 months, because with travel nursing, you make so much more money, dare I say, that I was able to then put that money aside and not work during times I didn't want to work. Like for me, I don't like to work through the winter time. I like to be home in the house. I don't like the heat, because I'm the type of person, one of my biggest pet peeves is getting in a car that's cold. I can't stand that. And I live in Ohio. So I just stayed in the house during Christmas, during Thanksgiving. That was actually me and my family. We were in Hawaii. So that was me and the kids. I took the kids to Hawaii. It was their first time. There's a Disney resort in Hawaii. It's called Alani. And so we went there. But what I'm trying to show you is that you can have the nursing career of your dreams when you have choices and when you have information and when you have knowledge. And so what ReMar is, we're so much bigger than an NCLEX review company, because I am about you having the lifestyle that you want, whatever that looks like, whatever, that looks like. For me, it's family. Like I'm anywhere my kids are. So my husband is, of course, you guys know Mark is everywhere. Do you need a bachelor's degree for travel nursing? No, you do not. You don't need a bachelor's degree for travel nursing. We have travel nurse assignments for LPNs. We have travel nurse assignments for ADNs. We actually had a company come in, call Mark, didn't we? They didn't want anybody with a bachelor's. They actually wanted people with ADNs. So what I'm trying to say is that Safe Nurse Now, please check out the jobs. All right. Go to remarnurse.com/jobs, remarnurse.com/jobs, so that you can take your career to the next level. An ADN is it's like an RN. Okay. It's like an associate's degree. Okay. But it's an RN still. Okay, so these are the things that we're just really excited about. Also, don't forget that Black Friday is coming, so I want you guys to be able to sign up for it. I will be talking more about Safe Nurse Now. Of course, I want you guys to, like I said, I want you guys to be able to take advantage of every opportunity that I put in front of you. I want you to have the information about it. Does that make sense? Safe Nurse is absolutely for international nurses. We will be bringing over so many nurses to fill the jobs that we have here in the US that are needed. There is 1 million nursing shortage here in the US. So we have 1 million jobs in the United States that need nurses. And so we have hospitals, we have companies that say, we want international nurses, because we need nurses, and we know this shortage is not going away. So if there's a nurse, and I told them we work with nurses in Africa, we work with nurses in the Philippines, but we're working with nurses in Africa right now. They want you guys here. Okay. Do nurses from Africa need NCLEX for travel nursing? Yes, you will have to. Anybody that wants to work in the United States, even us here, we have to pass NCLEX. We have to pass NCLEX. All right. I am coming from Safe Nurse all the way from Kisumu. Yes. So do you need experience? If you are already nursing your home country, you do not need U.S. nursing experience to come over. You need to understand the practices of United States by passing the NCLEX. And then we're going to make sure that the cultural aspects you understand. We will make sure that that location gives you a proper orientation. You guys know we're going to make sure, for me, one other thing that's very important is that you guys are coming over here to the US. You can come with your family, because I don't go anywhere without my family. So I don't expect my nurses to come over alone. I want you to have your husband. I want you to have your kids with you so that you can be happy and you're not worried about them. So we want you to come over with your family. And I also want you to get paid for the work that you're doing at the highest rate that you can get paid, the highest rate. Because honestly, the money's not for me. The money is for you, right? I want you to have as much as you can have. All right. When is your course going to count as a remediation? I'm working on that. I'm so working on that. Actually, is having conversations about that today, because I know in Florida, you need to have certain things for the course to be considered a remediation. Okay. What else? This is good. These are good questions. That's very good. I love this. CNAs, LPNs, RNs. LPNs and RNs right now for safe nurse. CNAs, I have not gotten any CNA jobs just yet. I want to make sure that my LPNs and RNs are placed, because these are travel nurse jobs. So it's just about availability. So I'll put that on my list though. I'm an international graduate. I don't have experience here in India. I would still say apply to remarnurse.com/jobs, because the jobs that we're getting vary. And if a place has certain skills that they require, they will put that as part of the job. If they're open to new graduates, maybe if you're working in a clinic or outpatient setting where you're just going to be doing subcutaneous injections, IM injections, things like that, then they may accept new graduates there, because they'll train you to do those kind of jobs. Okay. So we have domestic and international travel jobs. Do the safe nurses work on documentation for international nurses? Yes, we will. So Safe Nurse Now, if you're coming over from another country, we will handle your visa paperwork. We will handle that documentation. You just have to get us your credentials and make sure that you're certified. All of the other immigration and everything paperwork, we will do that through our process. Okay. Do the jobs have a residency program? Right. So that's why I want you guys to sign up for remarnurse.com/jobs, because you will be able to look for jobs in your state, in your city, or where you want to go. And each one of those jobs will have what it is offering. I would be very much open, and I'll actually tell our team that I'm open for new graduate residency positions, because that's how I started. I started in a residency position. All right. What else? Thank you. Thank you so much for all you do. I got into your program. I had no idea to start. Okay. Yeah, I know. And that's why we do it. We want to solve problems. It is very overwhelming what you need to know for NCLEX. So we want to make sure that is important. Susan Gonzalez says, passing USA NCLEX is necessary for your nursing job. Yes, it is. Where to go to take your NCLEX exam in Africa? You can go to Kenya. Kenya has a new testing center open. It is beautiful. I was there when I was in Kenya. Chef's kiss. Go there. This is going. Hi. What about international nurses who are already here? Well, if you are an international foreign trained nurse and you're in the USA, even better for you. You still have to go through the process of getting your education certified. But once you do that, you don't have to do you don't have to pay for a flight somewhere to take you to a location. You're in the US, so you can go to any one of our NCLEX testing centers. We'll help you. Just go to remarnurse.com/jobs, because your process is even simpler if you're already here in the US. Okay. All right. Send me an email if you have specific questions, support@remarreview.com. where in Nigeria can you test? You can't test in Nigeria. There's not a testing center in Nigeria. We have the ReMar nurses go to Kenya. Okay, that's going to be the closest place for you. This is so amazing. Yeah, it's really cool. It's really cool. It's really cool. And so if you are on your way to getting a nursing license, we can help you. If you're in nursing school, we can help you. But also if you're a foreign trained nurse now, ReMar goes beyond just the test prep. We want to help place you in a good job. And let me say this, not only are we going to do the job, because I know coming to a new country can be very scary. So we want to take care of the housing for you. So let me do your housing as well, so that when you come here, you just have to work. I'm also working on transportation so that I can help you get to and from work, so you don't have to worry about that at all. You guys, me being a travel nurse has really, really helped me to create an experience for you that will be sufficient, that will be more than what I see other people offering, and that will help you to be able to focus on just being a great nurse. When I was in Africa, when I was in Kenya, my host partners made sure that Mark and I and our kids got where we needed to go safely. You know, the area, they literally told us how to live in Kenya. And so we want to make sure that we do that for you. When you come with us, I want to make sure that you know how it is in the USA. You can come here, you can work, you can provide for your family. And then if you want to go back, you go back. Okay. That's what I want. I want you to have the choice to do what you want to do. Okay. All right. So that's it for tonight. We are on an amazing road. Yes, we are. And I'm so glad that you are along for the ride, because every single time I think that God is done, he opens up another door and it's like, bam, now you have jobs. What are you going to do? What are you going to do with that? I am going to position the ReMar nurses to have the very best in every area that we can have. Okay. So until next time, everyone, I hope you have a beautiful rest of your week. I hope you have a great weekend. Get some rest. All right. Because we're going to start all over again next week with something more, something better. Black Friday is coming. Black Friday is coming, guys. New products, discount prices. I got to go. New courses. It's so much to do. Oh, my goodness. But it's going to be a fun time. It always is. And we get to have turkey, because Thanksgiving is coming. So we get to have all our good favorite Thanksgiving food. So I'm excited about so much, but more importantly, what is the next level for you? So if you're interested in joining the ReMar family, tap the like button, subscribe to this channel, keep following, guys. And if nobody told you, you know I believe it. Yes, have a wonderful night. But also, no, thank you so much. Remember, thank you, Mark, for joining me here tonight. You're the very best, and very much a reason why all this is possible, because when you see a good woman, y'all see me looking good, y'all see me here happy. No, my husband is taking care of me to be able to do these things. So I appreciate you, Mark, so much. Thank you all. Have a good weekend. Bye-bye.